Hello, my name is Michelle Kutzler, and I am a veterinarian and an associate professor at Oregon State University. I'd like to thank you today for your participation in this lecture on honeybee veterinary medicine. I look forward to meeting you in person for a hands-on frame examination at a later date. The learning outcomes for this lecture are for you to understand what a normal beehive looks like, and then for you to be able to identify the differences between bacterial diseases that affect immature bees, or what we refer to as the brood. And last, for you to understand what your role is with beekeepers for treating foul brood diseases. Here is an example of a standard Langstroth beehive. The picture on the left illustrates a traditional hive that has, in the bottom box here, this is where the bees are located. This is where the brood is located. And then in this top box here, that's your honey super, and this is where the bees will be storing honey. As you can see, if you remove the honey super and look down into this bottom box, this is what you will observe. And what we're looking at are bees, of course, on the top of these frames that fit inside the hive. And in just a moment, I'm going to remove one of these frames, and then we're going to look at the frame itself. So in this image, I'm holding up a frame. This is the top of the frame here. You can see this is where it was balancing on top of the hive. And what you are observing here is the brood. Specifically, this is what we refer to as capped brood, because you can see that there are coverings over the cells. Of course, there are some cells here that are uncapped, and these may actually have eggs or larvae in them, and they would need to be evaluated. The most important thing to take home here is that this is a normal appearing frame with most of the cells filled with brood, either capped or uncapped. So very few cells without any brood inside. And then you can see that in the periphery, this is where the bees would store their resources, those being honey or fermented pollen, also referred to as bee bread by beekeepers. So this slide is illustrating the developmental stages of the honeybee in order to complete metamorphosis from an egg to an adult bee. As you can see on the leftmost picture rather, in the cells, these are eggs that the queen has laid at the bottom of the cell. And so in this picture, we would be the cell has actually been cut in half of the hive, and you're looking down inside the cell. So if you're looking directly into the cells here, once the eggs hatch, and here's an example, here's an egg here, and here's another egg here. But once these eggs hatch, they hatch into larvae, and the larvae should look white, glistening, and very plump looking. And so that's important to understand, again, what the normals are. You expect those larvae to look white and glistening and plump because some abnormalities in those appearances will be consistent with the diseases that we're looking at. So after the larvae have fully developed, they're ready to undergo metamorphosis, and the worker bee will cap the cell essentially making a cocoon for the bee to develop in. And here the bee is undergoing its final stages of development. At this stage, we refer to it as a pupa. And again, this is what we refer to as the capped cell. Another thing to notice with these cap cells is that the caps are convex in appearing. They're bulging, and that's another important normal sign that I want you to appreciate, because an abnormality would occur if the cappings were concaved. Kind of reiteration of what the normal duration is for a bee to develop. The queen bee stays, it takes her 16 days to develop from to emerge from the pupa stage. The worker bee, it takes her 21 days to emerge from the pupa stage. And the drone, or the male bee, it takes him the longest to emerge, or 24 days to emerge from the pupa. So let's look at what, again, normal larvae look like. And so again, we will see these larvae. They are very plump appearing, white, really glistening, again, covered with puddles of what we refer to as bee jelly. And this is what is nourishing those developing larvae. Again, here is a cell with egg in it that hasn't hatched yet. So similar to other animals that we work with, bees are susceptible to environmental, nutritional, and stresses, as well as parasitic and other pathogen stresses. And a combination of these stressors impacts the ability of the bee to fight off bacterial and viral infections, again, similar to the other animals that we treat in our practice. This slide is summarizing several honeybee diseases that occur. This list is not complete, but is described in greater detail in the handbook that I'll be providing you during our one-on-one hands-on frame examination. But for the purposes of this lecture, I'm going to focus on the 2 bacterial foul brood diseases in which veterinarians are often called on to write prescriptions or veterinary feed directives in order to help the beekeepers treat these diseases. And then I will touch shortly on a parasitic infection in bees, specifically that of the Varroa mite. So when we examine a hive, it's similar to when we examine a patient that comes into our practice, or a patient that we're examining in the field. First thing that we're going to do is take a history from the owner, and that for our purposes might be an opportunity to review the hive records. Have the bees been traveling recently? For commercial bees, they often are transported very long distances for pollination services, even out of state. Have the hives been inspected previously? Have they had problems with pathogens or parasites before? Has a beekeeper requeened recently? So again, several questions to ask before performing your hive exam. So then when you arrive, or when you start your hive exam, you want to look at the outside of the hive first. And what you might notice on the outside of the hive is the activity of the bees. Normally there are bees buzzing around the outside of the hive. Of course, it depends on the weather as well, but typically you want to see some activity around the outside of the hive as an indication of a healthy hive. Also, on the ground, just in front of the opening or the bottom board of the hive, you want to look to see if there are dead bees or other abnormalities that might accumulate in this area as the workers remove them from as the workers remove them from the hive. And so after you've examined the outside of the hive, it's time to examine the inside of the hive. And my recommendation is always to let the beekeeper handle the hive and open the hive for you. This will really decrease the chance that you will damage the colony or agitate the bees, and that will just make it safer for you to work and safer for the bees as well. The bees are accustomed to the beekeeper, to the person's smell and electromagnetic charge that we release as humans, and so the bees will identify us as a veterinarian as being a stranger and then be more defensive. And so again, just to keep the bees safe, I recommend having the beekeeper open the hive, and then after it's open, then we can go ahead and examine it. So what are you going to need in order to do a hive exam? Well, you're going to need some gloves, either latex or nitrile gloves. I just have a pocket full or bring a box because you're going to want to change your gloves between each hive if you're examining multiple hives. You're going to need either a veil or a bee suit. Many beekeepers will have an extra bee suit or veil for you to borrow, but a bee veil is something that covers your head and your face. It stops at your shoulders, and this will really, again, just keep the bees from flying around in your face, in your hair, around your head, and make it easier for you to more comfortably examine the hive. I purchased my veil through a company in Eugene, and it was fairly inexpensive. I want to say, maybe $30. So it's a pretty worthwhile investment just to have your own. You're going to need a flashlight, and in the Honeybee Disease Investigation Kit I'm going to provide you during our one-on-one hive exam, I'm going to provide you with a flashlight as well as forceps. And the forceps are used so that you can try to remove a scale or scales that might be present inside hives that look, or frames that look abnormal. Okay. In Learning Objective 2, I'm going to compare the clinical signs observed in 2 bacterial diseases that affect young bees, or the brood, and I'm going to contrast those to parasitic mite syndrome. First, with American foul brood, this disease affects only the capped brood. Those would be the pupa stage of the young bee, whereas European foul brood affects the larval stage, or the uncapped stage of bee brood. And in contrast, parasitic mite syndrome can affect all stages of bee brood. With respect to what remains in the cell after the worker bees have removed the diseased brood, in American foul brood, the remaining scale, and I'll explain to you what that looks like here in a minute, is difficult, if not impossible, to remove without damaging the cell. However, with European foul brood, the scales are easily removable, and often the bees will remove these scales in the purposes of cleaning out the cells in preparation for the queen to lay another egg. With parasitic mite syndrome, scales may or may not be present. With respect to American foul brood, they are positive to the ropey test. That will make more sense here in just a minute. Whereas with European foul brood, they are negative to the ropey test, and this is also true with parasitic mite syndrome. And so just to recap, the positive ropey test is pathognomonic for American foul brood. Both American foul brood and European foul brood have an odor associated with them, hence the name foul brood. However, the odor that is produced from American foul brood is much stronger and more easier to identify compared to European foul brood, where some people, because of their sense of smell, may not be able to smell it, or they don't find it to be particularly objectionable. However, with parasitic mite syndrome, you can smell the smell of dead or decaying bees, but you won't smell the kind of the typical foul brood smells that are associated with American foul brood and European foul brood. And I hope that during our in-person frame exams, I'll be able to help differentiate those smells for you. With all three diseases, though, the spotty brood pattern is consistent. And last, the appearance of these diseases, we typically see American foul brood any time of the year. That is because this is a spore-forming disease, and the infection can reoccur at any time. Whereas with European foul brood, typically this is associated with spring, when bees have returned from traveling for pollination services, when maybe resources, so nectar and pollen are low, so the bees have additional nutritional stress, and these additional transportation nutritional stresses weaken their immune system and predispose them for this bacterial infection. And last, parasitic mite syndrome, we typically see this in late summer or fall. So first, talk about American foul brood. As I mentioned before, this is caused by a spore-forming bacteria, Pienobacillus larvae. As I mentioned before, it affects the capped brood stage, and it has both a spore stage as well as a vegetative stage. And in the spore stage, the bacteria is unaffected by antibiotics, and these spores can remain in the frames, in the hive, and in the environment for many, many years. This is a serious disease, and in many states it is a reportable disease. However, it is not a reportable disease in the state of Oregon. But having said that, it is a rare disease, certainly more rare than European foul brood, and even extremely rare compared to parasitic mite syndrome. As I mentioned before, the clinical signs observed with this disease include foul odor, very pungent, and sunken or perforated caps. So if you look at those capped cells, instead of having that convex or dry appearance, they'll look sunken in, so concaved. You might see openings or perforations within the capped cells, the cappings, and the cappings can also look moist or sweaty. If you use a toothpick or a wooden stick and you perforate one of these capped cells and stir around the contents and then remove that stick, there will be a thick strand of mucus that will be displaced as the stick is being removed from the cell, as illustrated on this picture on the right. And this is what is referred to as a rope or a ropey larva, and this is, as I mentioned before, is pathognomonic for this disease. Also, it's not uncommon to see a scale at the bottom of the cell, which is the remnant or the vestige, if you will, of the pupa that has died inside the cell. And the scale is so tenacious in its attachment inside the cell that it's difficult, if not impossible, to remove with forceps, and the worker bees cannot remove it either. Again, this is an illustration of what a frame might look like with American foul brood. First of all, you can appreciate this spotty pattern of brood. So you have several cells that are uncapped that have no larvae or eggs in them. And this would be very uncommon. This right away should make you think that there's something wrong with this hive. The next thing that you can observe here is that there are some sunken cells, some sunken caps here. And then you also see some broken caps. So here this cap is broken open. Another one that's broken open. And then you also see what's referred to as sweaty caps. So here you have this appreciation that it's sweaty. It actually looks purulent to me, the infected pupa and its contents as they are kind of leaching through the wax cap over the cell. This image illustrates those hard scales that I mentioned before that are present on the bottom of the cells. And so here you can see a hard scale, and here is another hard scale. And then of course all of these ones have these hard scales in them, whereas the rest of these cells don't have anything inside them at all. They're empty. If you tried to remove these scales with a forceps, it would be very likely easier to break the cell around the scale than to detach the scale from the cell.
This frame brood does not look good at all. It's very spotty. It has some larvae melted down to a goo and some sunken cells. So I'm going to do the rope test I just picked up a stick from the ground and going to see if it's American foul brood. So I just stick it in the goo, move it around, and pull it, and yeah, it is definitely ropey. So this is American foul brood, so this is not good at all.
In this video, you will see how to perform a frame examination. Specifically, the problem with this frame is American foul brood, and you will see how the inspector is making that diagnosis. Video, you will see how to see the scales when examining the frame. It's important to note that when you're looking directly into the cells, it's difficult to see the scales, but once you turn the frame slightly at an angle so that the cells are pointing up towards a light source, you'll be able to see those scales easily. European foul brood is caused by the bacteria Melissococcus plutoneus. European foul brood affects only the open cells, so it affects the larval stages. If you recall, a normal larva should be white, glistening, and plump appearing. In this frame that's affected by European foul brood, you can easily see abnormal larvae that are discolored, desiccated appearing, or completely dried up here, forming a scale. European foul brood can have an odor, but unlike American foul brood, it does not have as strong of odor, and depending on an individual's sense of smell, it may or may not be detectable or noticeable during the exam.
And then at a closer look, we can see larvae in the cells, in open cells that are discolored, yellowish, and melting towards the bottom of the cell. To make sure it's not American foul brood, we'll do a ropey test. So we have a stick, a wooden stick. We'll take it and stir around a larva inside of a capped cell, pull it out, and see if it ropes. It's not roping to look like an American foul brood. We'll do one more. Capped cell, stir it up, and pull it out. No ropiness. So it's not American foul brood. This is European foul brood.
In this video, you will see how to examine a frame and observe the signs of European foul brood.
And then at a closer look, we can see larvae in the cells, open cells that are discolored, yellowish, and melting towards the bottom of the cell. To make sure it's not American foul brood, we'll do a blood test. We have a stick, we take a stir around larva inside the cap cell, pull it out, and see if it ropes. It's not roping.
In both American foul brood and European foul brood, scales are present, but when observed in the cells, if you try to remove that scale with a forceps, it will easily come out of the cell. So this is another way to distinguish between European foul brood and American foul brood. Parasitic mite syndrome is a huge problem for bees, but the treatments required to treat parasitic mite syndrome do not require a veterinary prescription. So Many beekeepers will work on treating these diseases on their own and not necessarily contact a veterinarian for help. However, parasitic mite syndrome does have many similarities in its appearance to the bacterial diseases that veterinarians will be asked for prescriptions to help treat or control. As you can see in this figure on the left, there are several open capped cells, like you can see here and here and here. And this would be suspicious of American foul brood because this is a disorder that affects the capped brood. But you can also see that there is some yellow or discolored larvae here as well. And so that would perhaps mimic what you would see with European foul brood. In this picture on the right, again, you can see evidence of open capped cells as well as some scale formation here. So parasitic mite syndrome, just as the name would imply, involves mites, and these mites are huge relative to the size of the bee. You can see the evidence of these mites here, and they're predominantly a problem within the capped cell because just before the cell is capped, the female mite will crawl into the capped cell underneath the larva, and then once the cell is capped, she will lay up to 20 or 30 eggs, which will hatch into these adult mites while the bee is undergoing the last stages of metamorphosis inside the capped cell. The discussion on how to diagnose, manage, treat parasitic mite syndrome is beyond the scope of this lecture because it is quite complex and time-consuming, but I highly recommend that you visit the Honeybee Health Coalition.org/Varroa for more information about how to diagnose, manage, and treat parasitic mite syndrome if your clients are interested. For many veterinarians, we like to follow up our examination with performing some diagnostic tests, and there are hive side or in clinic ELISA tests for American foul brood and European foul brood. I have included one of each test kit in the honeybee disease investigation kit I'm going to be providing you during our face-to-face one-on-one frame exam. If you need to purchase more of these come in a bag, a pack of 10 or 25, and you can purchase those online. Alternatively, you can remove a 2-inch section of honeycomb from the infected or the frame that you're concerned about, and send that to us here at Oregon State University. I've included the name of the research associate in charge of the disease investigation work, Carolyn Brees. Her email and telephone number is listed here, as well as the USDA Bee Research Lab in Maryland. In both our lab as well as the USDA lab, we perform these diagnostic tests for beekeepers, veterinarians, bee inspectors, etc. at no cost. So please feel free to utilize these resources. There are 3 antibiotics that are labeled for use in honeybees for either the control of American foul brood or the treatment of European foul brood. The one that's used most commonly is oxytetracycline. The dosage is listed here, but it will also be included in the booklet that I'll be providing to you during our one-on-one meeting and frame examination. You can see that this needs to be applied 3 times at 4 to 5 day intervals, and as with most antibiotics in food animals, must be discontinued before honey collection at least 6 weeks in advance. In addition to oxytetracycline, tylosin and lincomycin are also labeled for use in honeybees for the control of AFB and the treatment of EFB. Tylosin, depending on whether it comes as a liquid or a solid, can be diluted in either sugar or sugar syrup, and the same with lincomycin. As with oxytetracycline, because they are being used in food animals, the treatment must be discontinued at least 4 weeks before honey is going to be collected for food consumption. So the third learning objective really relates to how, as veterinarians, we can assist beekeepers in the treatment or control of these bacterial diseases. In addition to writing a prescription, which most veterinarians are familiar with writing prescriptions, veterinarians who work with food-producing animals may also be asked to write a veterinary feed directive, or a VFD. A VFD is a special kind of prescription that is used when antibiotics are added to a food source for a food-producing animal. Because honeybees are listed by the FDA as a food-producing animal, when they are treated with food that contains antibiotics, then they need to have a veterinary feed directive written for them. As a veterinarian feed directive, like I said, is very similar to a prescription. You can see the elements that are included on the veterinary feed directive include the veterinarian's name and contact information, the client's name and contact information, the antibiotic that's going to be used. Of course, with honeybees, it can only be oxytetracycline, lincomycin, or tylosin. And the disease that we're using it for is only going to be American or European foul brood. And then how many hives will be treated, where the hives are located, and then the instructions for administration, as well as how long the withdrawal period is following the end of the feeding of the medication. For veterinarians who are unfamiliar with using a veterinary feed directive, I've created a fillable PDF template that you can see on this slide, and I can send that to you by email, so that way you can have an electronic version available to help write veterinary feed directives for beekeepers if you determine that an antibiotic is needed. Similar to other patients, a veterinary client-patient relationship is necessary in order to write a prescription or issue a veterinary feed directive for any patient, including a honeybee colony. The requirements for a veterinary client-patient relationship vary state by state, but in the state of Oregon, the minimum standards for a veterinary client-patient relationship have adopted telemedicine, which expands our reach as veterinarians for both clients and patients that are in more remote locations. And this may be true for beekeepers and their hives. Many beekeepers in Oregon belong to the Oregon State Beekeepers Association. On the Oregon State Beekeepers Association website, there's a listing of veterinarians that will work with beekeepers to write veterinary feed directives and prescriptions in the case of these foul brood diseases. After participating in this training and a hands-on exam of the frames, which we'll do at a later time, I hope that you will join your colleagues and be listed on the Oregon State Beekeepers Association website so that beekeepers can contact you if they're having troubles. Thank you again for your interest in honeybee medicine and participation in this video and the hands-on frame examination. I hope that the information that you found in this lecture was useful and generated questions that we can discuss in further detail during the hands-on frame examination. Please contact Samantha Miller, the honors student working on this project, to schedule the hands-on frame examination. Thank you again. Stay safe and have a great day. Again, as evident on this frame exam, you could see these very discolored looking larvae, yellow colored, that are melting to the bottom of the cells, no longer that white or plump appearance to them. So this is a good example of a European foul brood. And so here are those scales again. There's one there, there, here, and here. In this next